Welcome to The Heart of Health Live. There's a place for modern medicine in your life. Learn to use it correctly by getting your toughest questions answered on today's broadcast. Discover modern medicine's strengths and weaknesses. Lifestyle medicine opens the door to optimum health and healing. How you live and what you eat can profoundly affect mind and body. Learn simple solutions to complex problems. God provides the ultimate healing we all desire. He wants us healthy and happy. We just need to understand His plan for our lives and live accordingly. And now, live from Studio 1A in Chattanooga, Tennessee, here's your Heart of Health host, Dr. James Marcum.
We want to welcome everyone today to Heart of Health Live, where you are the program. And we have a very interesting program today, and we hope everyone is just having a wonderful day. And if you want to be a part of your program, we're going to be talking about obstetrics and gynecology. That's women's health, having babies, all those neat things. And if you might have a question, we want to give us a call. Our toll-free number is 855-644-3278, and we have operators standing by waiting to take your call. And today we have a specialist, a fellow in the American College of Obstetrics Gynecology, Dr. Steve Wolf. And Dr. Wolf was telling me he sees patients every day that has all sorts of questions. So if he can't answer your question, we're going to find someone who can at another date. But he answers questions every day, so there's no questions that's too hard or too easy. We want to hear from you. We also want to thank those who've sent their questions on our website. That's heartwiseministries.org. We'd be happy to answer your questions there. And also, if you want to join us on Facebook, you can be a part of this discussion on Facebook as well. Many of you are watching on television, but we're also streamed live on the internet as well. That's heartwiseministries.org. Well, in the news this week, we have learned that ovarian cancer kills about 15,000 women a year. And the cure rate, if detected early, is almost 100%. Well, you know, you can't believe everything you hear in the media. We're going to ask Dr. Steve Wolf if that's as accurate or it's not. We're also going to talk about estrogen. Should a woman take estrogen? Should they not take it? If I'm having hot flashes, do I need it? And yet in the field of cardiology, we're scared of estrogen because we know estrogen can cause clots. It can precipitate all sorts of heart issues. So that's a question we're also going to tackle today on our program. But we also want more than that. We want to answer your questions. And remember, on HeartWise, we let people know there's a place for modern medicine. There's a place for lifestyle, but we also want to point you to a relationship with the Creator to bring you to ultimate healing. That's very part of every treatment plan. So give us a call, 855-644-3278. Guess what? Dr. Wolf is here in studio, and he's going to be answering your questions. Stay with us.
The Heart of Health Live will return in just a moment.
The Ultimate Prescription by cardiologist Dr. James Marcum is taking the nation by storm. People everywhere are learning what living a healthy life is all about. If you're happy living a drug-filled, pain-filled, mundane existence, this book is definitely not for you. In this book, Dr. Marcum dives into modern medicine's strengths and weaknesses and explains how lifestyle choices can significantly impact your health. To get your copy, visit Barnes & Noble or shop online at Amazon.com.
Hello, I'm Dr. Tim Jennings with your Mental Health Minutes. Are you pregnant or thinking of becoming pregnant? Do you want to ensure your child will have the healthiest brain possible? Then avoid all alcohol because as little as 1 glass of wine per week alters brain development and is associated with behavior and emotion problems. Avoid smoking. Children born to mothers who smoked had higher rates of learning and behavior problems and psychotic disorders. Take omega-3 fatty acids. Omega-3s promote healthy brains and higher IQ. And watch out for depression. Untreated depression is associated with delayed fetal growth and altered brain development. However, antidepressants can increase miscarriage rates, contribute to smaller fetal heads, and slow growth in the newborn. If depressed, consider transcranial magnetic stimulation, the only FDA-cleared, drug-free treatment for depression with no risk to the fetus. To be smart requires a healthy brain, so be smart, do right, and make your child bright.
To learn more about mental health, visit comeandreason.com.
Imagine a classroom with no boundaries. A classroom where reenacting a book is an English class, and repairing a motor is a math lesson. A classroom where caring for horses is biology. This is our classroom. At Bachman Academy, 6th to 12th graders with ADHD, dyslexia, and other language-based learning differences are provided a language-rich, hands-on program of study. With an average of 5 students per teacher, Bachman students receive more attention and have more time to learn while using their own learning strengths. Now, imagine your child in this classroom. To learn more about Bachman Academy, visit our website at www.bachmanacademy.org. Bachman Academy, tapping potential one person at a time.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back to Heart of Health Live. We hope you're having a great day today. We're answering questions about obstetrics and gynecology. So if you're a woman, you might be especially interested in this program. If you're a man, you might also have some interest in this. Give us a call. Our number is 855-644-3278. We're here with Dr. Steve Wolf. Dr. Wolf, thank you for joining us on Heart of Health Live.
Thanks for inviting me, Jim.
And let me tell you, what got you interested in the field of medicine, and progress how you got interested in medicine and then how you got into obstetrics and gynecology?
Well, I started out, for whatever reason, I thought I was interested in medicine from a very young age.
Well, how old's young? You know, like
I
6
would
or
say,
7?
7, 8,
Wow.
somewhere in that
Okay.
range. And it's been a goal most of my life. And then this actually obstetrics and gynecology turned out to be a second career for me because I started out in family medicine.
Okay.
I thought I wanted to do everything that had to do with medicine. I was in a small town for about 4 years practicing general family practice.
Okay.
And really, the part of my practice I enjoyed the most was obstetrics. But I felt a little bit handicapped being a family practitioner, not able to complete some of the things you need to do with obstetrics. You know, not being able to do cesarean sections or surgeries or actually helping out with some of the more extensive problems. So I committed another 4 years of residency and went back and became board certified in OBGYN and ended up with obstetrics and gynecology as my profession.
Now, we hear a lot nowadays about shortages, that your type of profession, your type of specialty is running out of doctors. They don't want to practice that anymore. What drives you? What's the passion that you have? What do you really enjoy about obstetrics and gynecology?
You know, I love the profession because it's not only do I get to do preventative care with women every day and help them have a healthy lifestyle, but I get to participate in procedures. I'm surgically trained, so I can do pelvic surgery. I love doing obstetrics and bringing new life into the world and helping women have healthy pregnancies and delivering healthy babies. So there's so many great aspects of obstetrics and gynecology. I don't know why everyone doesn't want to do it, I guess.
Well, you know, I think it's for some of us, it scares us, you know. When people are screaming, it gets me a little bit scared. And when I was in medical school, as part of a requirement, we had to deliver so many babies at the University of Texas, San Antonio. And one time I was in the middle of the night and the baby wasn't doing what I wanted to do. It came out backwards and stuff. And it got me my heart was like a little pounding a little bit. And I got really scared. So ever since that, it wasn't for me. So
obstetrics is 95% calm and happy and punctuated with 5% of sheer terror. So I guess that's what gets me up at night is when the moments of sheer terror.
But you know what? It must be real special to bring a life into the world.
Absolutely. There's nothing better in all of medicine than to deliver a new baby.
And I can't imagine, you know, you're not old enough to have this, but can you have someone come back to you and say, "Oh, you delivered me, Dr.
That's
Wolf,"
right.
when they've grown up a little bit? Right. So you get that to look forward to.
Right. Okay. It starts about, I'm getting to the point now where people are coming back and saying, "You actually delivered me." and they're pregnant. So it's
wow. Well, you look much younger than that. You look much younger. Listen, we have quite a fean questions that come into our website. If you have a question, you can be part of our Facebook team, or you can join us on heartwiseministries.org. We're just going to start on this first question before we get to break. This person writes in and says, I am interested in beginning birth control. What options are available? So I guess first we need to define in just a minute before we talk about the option, what is birth control in general for those that might not know?
Well, birth control is a method to prevent pregnancy.
Okay.
And fortunately or unfortunately, most all birth control methods deal with the female, and there just aren't any pharmaceutical methods that deal with men currently.
Right.
There are some in development, but none that we can use currently. The most common thing that people are aware of is the birth control pill, and the birth control pill's been around for over 40 years now, and has been very successful. It's been adjusted over the years so it's more tolerable and very effective at preventing pregnancy. It requires taking a pill on a daily basis. Okay. There are new methods to transmit those hormones into the system now with shots, patches, even a vaginal ring that can be used to transmit those hormones.
I want you to hold that thought because we have to go to a short break, but stay with us. Give us a call, 855-644-3278. We're going to be back with Dr. Wolf answering your questions after this short intermission. Stay with us.
The Heart of Health Live will return in just a moment.
There's a place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance, when to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have ultimate healing? I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
Nice. No. Come on. Oops. Yeah, sure. Let's go.
Moms everywhere are finding ways to keep kids active and healthy.
Works every time.
Get ideas, get involved, get going at letsmove.gov.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
We're back talking with Dr. Steve Wolf, obstetrics gynecologist, and we talked last section a few questions about I'm interested in beginning birth control, what options are available, and we talked about birth control pills as one option in the many different ways you could release the hormones. And we have a question coming in from Stephen. And Stephen wants to know, Stephen, are you on the air with us? Not quite yet, but he's going to join us in a second. We'll have his questions. But are there any other forms of birth control that we talked about?
There's some newer forms that are becoming more popular because they're not so burdensome in that you don't need to take a pill every day.
Right.
And I mentioned the vaginal ring, which is good for a month at a time.
Okay.
There are patches that you wear a patch for a week at a time.
Okay.
There are some implants now that are really good for young girls. There's an IUD that can be inserted in the uterus that is very effective at preventing pregnancy and is good for 5 years.
5 years?
And
wow.
Forget about it.
Okay.
There's also an implant that goes in the underside of the arm.
Okay.
That's good for 3 years at a time.
3 years, wow.
And a lot of those are being promoted towards younger women who, you know, have active lifestyles and are not interested in being bothered by something that they have to take every day.
Which is the most inexpensive?
Inexpensive, I would say now you can, as far as effective hormonal method, would probably be some of the generic birth control pills.
Okay. Now we have a question from Steve. Steve, you're on the air with Dr. Wolf. Can you hear me right now?
Yes, sir.
What's your question for Dr. Wolf today?
Oh.
You're on, yeah.
Okay, well, my wife just had a child. We just had our first son on the 8th of August, and we don't want to do this within 9 months from now again, all over again. So we're trying to see, I'm kind of like a natural guy, I like taking natural, organic, vegan-based vitamins, and she kind of like, she's the same way. And she's currently trying to fill out a prescription for birth control pills, but we're trying to see the best alternative, or if they're okay. Is there something? Is there a better way, another way, while at the same time saving on costs?
Okay, Dr. Wolf.
Well, as I mentioned, birth control pills are probably the most inexpensive currently because you can get them in a generic form. But when you look at the long-acting methods, they may be cheaper in the long run. An IUD may be expensive up front, but if you use it for 5 years, it's very inexpensive.
Right.
There is also an IUD that's good for 10 years that has no hormones in it whatsoever if you're interested in not having any kind of hormonal influence at all.
So that would probably be the most natural way, right?
Probably, yes. That's
okay.
It's a copper IUD, and it's you can implant it, and it's good for 10 years.
And you just go to your doctor, and he puts it in, and then it's good for 10 years. So that might be an option for you, Steve. Steve, you still there?
Yes. So
yeah.
It would have to be surgically implanted?
It's not. It's actually just inserted in the office, just like doing a pap smear almost.
Okay.
And it can be removed at any time, so that if there's a string on it, so that if you decide in 3 years you want to have another baby, you can just come in the office and have it removed and attempt pregnancy right away. There are also more natural forms of preventing pregnancy. They're not hormonal, but they're also not as reliable, and that's methods where you check the cervical mucus or time your intercourse so that you avoid the most fertile time of the month. There are also kits on the market that you can tell when you're ovulating or when a woman is ovulating, and a woman ovulates once a month in the middle of her cycle, and if you can avoid that time period, you can avoid pregnancy. Not as reliable, obviously, as the hormonal methods, but there are ways to do that. You can do that with checking her temperature, too. So.
Now, Steve, is this your first child?
Yes, sir.
Well, we want to congratulate you. Congratulate you on being a new father, okay?
Oh, thank you.
Well, I hope this answers your questions. You know, if you don't want to use the hormonal replacements, Dr. Wolf talked about an intrauterine device, an IUD, or you could sort of do, you know, timing of this, and hopefully that answers your questions today.
Okay.
Well, thanks for calling, Steve, okay?
Appreciate it. You guys have a great day.
Okay, thanks.
Thank you.
All right.
And that was Steve calling from Kentucky. And if you have a call, you might want to give us a call, 855-644-3278. We're here with Dr. Wolf, who's answering your questions. He's not going to send you a bill, so send your question in. Stay with us. We're going to be right back.
The Heart of Health Live will return in just a moment.
The Ultimate Prescription by cardiologist Dr. James Marcum is taking the nation by storm. People everywhere are learning what living a healthy life is all about. If you're happy living a drug-filled, pain-filled, mundane existence, this book is definitely not for you. In this book, Dr. Marcum dives into modern medicine's strengths and weaknesses and explains how lifestyle choices can significantly impact your health. To get your copy, visit Barnes & Noble or shop online at Amazon.com. Imagine a classroom with no boundaries. A classroom where reenacting a book is an English class, and repairing a motor is a math lesson. A classroom where caring for horses is biology. This is our classroom. At Bachman Academy, 6th to 12th graders with ADHD, dyslexia, and other language-based learning differences are provided a language-rich, hands-on program of study. With an average of 5 students per teacher, Bachman students receive more attention and have more time to learn while using their own learning strengths. Now, imagine your child in this classroom. To learn more about Bachman Academy, visit our website at www.bachmanacademy.org. Bachman Academy, tapping potential one person at a time.
Have you ever heard things about God that didn't make sense? Have you ever thought that science and Scripture cannot be reconciled? Have you heard ideas about God that scare you? Or are you just tired and confused? If you want answers to complex problems, if you want a testable, evidence-based understanding of God and the world around you, an understanding in which the Bible and science harmonize to reveal the reality that God is love all the time, then Come and Reason Ministries is for you. Hi, I'm Dr. Tim Jennings, board-certified psychiatrist, and Come and Reason Ministries is dedicated to helping you learn to discern, to stimulate you to think, to help hone and refine your ability to know the right from the wrong, the healthy from the unhealthy, and teach you how to experience healing of your mind, body, and relationships here and now. If you would like an evidence-based approach to knowing God, then visit us online at comeandreason.com.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back. Give us a call, 855-644-3278. Go to website, heartwiseministries.org, or you can be part of our Facebook family. We'd love to have you. What we try to do every week is answer questions. We're not selling products. We're not making any money. We're just wanting to serve our fellow man, give them some good medical knowledge. And we're here with Dr. Wolf, and he was talking a little bit about ways about birth control. We've talked about a few ways. Is there any other ways that we haven't mentioned so far?
I didn't mean to leave out part of Stephen's answer because he wanted something more natural. There are many barrier methods on the market that are not as reliable as hormonal methods at preventing pregnancy, but condoms, certainly the best defense we have against sexually transmitted diseases.
Right.
There are vaginal suppositories and different spermicides that can be used. And again, they're not as reliable as some of the hormonal methods, but they're very effective if used appropriately.
Now, as far as percentage goes, which one is percentage-wise up at the highest top of the list?
As far as preventing pregnancy,
Yes.
IUDs.
IUDs
would be the best at preventing pregnancy. Then I would say any of the hormonal methods, patches, pills, shots, those are all very effective.
Now, what happens if you miss a day or two of the pill? Does that really mess things up?
Not really. As long as you recognize that you missed that pill, you can double up the next day on your next pill. Because pills anymore are such low dose, you may get what's called breakthrough bleeding. You may get some bleeding as a result of that. Doesn't necessarily mean you're at risk of pregnancy as long as you pick up that extra pill and continue on with your pill pack.
Okay, great. Well, we're going to go to a different subject right now, and that, unfortunately, is cancer. And this patient writes into Heartwise Ministries. They say, my mother had ovarian cancer. I'm 28 years of age. Is there any screening that I should have done? So here we have someone that mom had cancer, 28 years old. Should they have anything done?
It's a great question. The problem with all cancers, not just ovarian cancer, is that it's not just one disease. And there are about 16 to 17 forms of ovarian cancer.
Wow.
Now, what's interesting about the question is the most common forms of ovarian cancer is what's called an epithelial type of ovarian cancer. Those are the most common ones. Hard to detect early on, though. And there is not a good screening test for ovarian cancer. But in people who have a family member who has ovarian cancer, there are these genetic syndromes that we test for. There's one called BRCA1, one called BRCA2, another one called the Lynch syndrome. And what these are is chromosomes that occur in families that may put other family members at risk of developing ovarian cancer or some other cancers like breast cancer and things. And those are detected through a blood test. Now, the ideal way to evaluate that is to have the person who actually has the cancer be tested to see if they actually are a carrier.
Right.
If that person's not available, then the people who may be at risk, such as daughters or sisters, or even mothers, if a daughter developed ovarian cancer, then they should be tested for those genetic syndromes. Certainly, if you're positive for one of those genetic syndromes, women are now making the decision that they may want to have their ovaries removed when they've completed their families and things to help reduce that risk of developing ovarian cancer down the road.
So for the most common, it sounds like there's no really good screening test.
There's not a good screening test. People have talked about using pelvic ultrasound along with some blood tests. There's a blood test called CA-125, which is very good for monitoring women who've had ovarian cancer. Is not a very good screening test because it's positive for a number of reasons why it might be turned positive. And a number of years back, there was a very good study done in Canada where they screened over 1,000 women with CA-125 and ultrasound. And the outcome of that study was that they found one ovarian cancer in well over 10,000 women. That got narrowed down to 1,000 women who had an abnormal CA-125, or about 1,000 women. And they only found one ovarian cancer, but about 600 of those women underwent surgery.
Oh,
so
boy.
that's not a very good screening test. You know, so at this date, we don't have a good screening test. The best is to have a regular exam by your gynecologist, checking for masses in the pelvis on an annual basis. Unfortunately, most ovarian cancers, when they're discovered, are what we call stage 3. They've spread into the upper abdomen already. But typically, you find those in women who don't get regular exams. You know, so I think it's really important that a woman have a regular annual exam.
Well, we're going to break right now, and we encourage you to give us a call, 855-644-3278. We're talking about women's health, especially obstetrics and gynecology. Stay with us.
We'll return in just a moment.
Have you ever heard things about God that didn't make sense? Have you ever thought that science and Scripture cannot be reconciled? Have you heard ideas about God that scare you? Or are you just tired and confused? If you want answers to complex problems, if you want a testable, evidence-based understanding of God and the world around you, an understanding in which the Bible and science harmonize to reveal the reality that God is love all the time, then Come and Reason Ministries is for you. Hi, I'm Dr. Tim Jennings, board-certified psychiatrist, and Come and Reason Ministries is dedicated to helping you learn to discern, to stimulate you to think, to help hone and refine your ability to know the right from the wrong, the healthy from the unhealthy, and teach you how to experience healing of your mind, body, and relationships here and now. If you would like an evidence-based approach to knowing God, then visit us online at comeandreason.com.
So here's a question. If you love Jesus, and I mean truly love Him, people will notice, right? I mean, if Jesus is at the center of everything you do, people will have to notice. And that is exactly what Life Talk is all about. You see, at Life Talk, our goal has always been to connect people to the true source of power, Jesus Christ. We know with Jesus at the center of our lives, nothing is impossible.
place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance, when to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have ultimate healing?
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back. We want to especially welcome our listeners watching in the Cleveland area on WTNB and in the northern Georgia, Chattanooga area on WNDD. We want to thank you for joining us. We're here with Dr. Steve Wolf. Dr. Wolf, we're finishing talking about ovarian cancer. In the opening, we said 15,000 women die of ovarian cancer. That's a lot of women.
It is.
90% can be cured if detected earlier. And now we're finding out that there's really no easy way to detect these cancers earlier.
I think what you're referring to, detecting it early and with a 90% cure rate, is if you can detect it in a stage 1,
right,
where the tumor is confined to the ovary and hasn't spread beyond the ovary to the uterus or to the pelvic organs. And those are the hardest ones to detect because the ovary is kind of free floating in the lower abdomen,
right,
and it really doesn't cause symptoms of any kind until it gets larger. Sometimes we as gynecologists will detect that just on an exam. Sometimes we'll pick it up on an ultrasound if we suspect something. But it's tough to find an ovarian cancer at stage 1.
Because I guess cost efficiency will not let us do ultrasounds and more sensitive tests on for instance, this 28-year-old that has a family history.
No, and it doesn't become cost effective because then there are so many different things you find on ultrasound that are suspicious, that lead to other tests, and then pretty soon it's ballooned to the point that it's not really a cost-effective thing to do.
And I tell my patients, doctors many times manage risk,
right,
which is riskier than what comes with the test, or all manage risk.
Right, and you have to keep in mind that a cyst on an ovary is normal in someone who's of the reproductive age range because those are eggs that are developing there on the ovary. So if we operated on everyone who had a cyst on their egg, that's all we would, or on their ovary, that's all we would do all day
long. That's right. If anyone might have a question out there, Dr. Wolf's ready to answer your questions, 855-644-3278. He's more than qualified. He's a board certified obstetrics gynecologist. He has a practice called Life Circle. So give us a call. The next question comes in by someone that's pregnant, and this came into our website, Dr. Wolf. And this person writes in, I'm planning on getting pregnant and will be 40 years of age next month. At what age or around what age do the risk of pregnancies increase? We hear about all these older women getting pregnancy, 70, 80, I mean, you hear occasionally about some older people getting pregnant.
Yes.
On the Enquirer and things like that. But what do you advise people? What would you advise someone that might be asking this question?
Well, there are risks that do increase as women become older. The first thing we would need to talk about with someone who's 40 years old is the chance of getting pregnant, because fertility rates drop, and most women by about age 43, 44 are unable to get pregnant.
Right.
So time's a wasting in somebody who's 40 years old. But there are some risks that increase, such as increased risk of miscarriage the older you are, increased risk of genetic abnormalities. Now, there's not a specific age that I would say is a cutoff, but we know that the risk of genetic abnormalities begins to increase around age 27, 28, and gradually increases. If you look at a 20-year-old, her risk of a genetic abnormality in pregnancy is about 1 in 2,000 in the general population. If you look at a 40-year-old, that risk is about 1 in 50.
Wow.
So that the slope of that line increases pretty rapidly once you get into your 30s and up towards 40. The other risks that occur as you age are increased risk of high blood pressure that occurs in pregnancy, increased risk of diabetes occurring in pregnancy, or what's called gestational diabetes. None of those are reasons for a person not to attempt pregnancy because they can all be managed, but they should be aware that their risks are increased. And the truth is that as women are developing more and more careers, women are waiting longer to have babies. So we see more of these problems now, and I would call them mature gravida now is the term we use.
Now, before we go to break, do you do some genetic testing if they need that done, or?
We do. There's kind of a worldwide or a national standard that anyone who's 35 years old or older be automatically offered genetic testing for genetic abnormalities, but it's available to anyone who's interested, and then we screen just based on history as far as what family histories are as far as genetic abnormalities. And then, of course, ultrasounds are done throughout a pregnancy. There's to look for possibilities of abnormalities. There's blood testing and more invasive testing that can be done to screen for genetic abnormalities.
Okay, well, good. Well, I hope that answers your question. 855-644-3278. You're watching the Heart of Health Live, where you're part of the program. Give us a call.
The Heart of Health Live will return in just a moment.
The Ultimate Prescription by cardiologist Dr. James Marcum is taking the nation by storm. People everywhere are learning what living a healthy life is all about. If you're happy living a drug-filled, pain-filled, mundane existence, this book is definitely not for you. In this book, Dr. Marcum dives into modern medicine's strengths and weaknesses and explains how lifestyle choices can significantly impact your health. To get your copy, visit Barnes & Noble or shop online at Amazon.com.
In the small town of Elmira, New York, a boy was born into an all-American family. The odds of him achieving his dream in the fashion industry? 1 in 23 million. The odds of having a child diagnosed with autism? 1 in 88. I am Tommy Hilfiger, and my family is affected by autism. Learn more at autismspeaks.org/signs.
I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
Hello, I'm Dr. Tim Jennings with your Mental Health Minutes. Are you pregnant or thinking of becoming pregnant? Do you want to ensure your child will have the healthiest brain possible? Then avoid all alcohol, because as little as 1 glass of wine per week alters brain development and is associated with behavior and emotion problems. Avoid smoking. Children born to mothers who smoked had higher rates of learning and behavior problems and psychotic disorders. Take omega-3 fatty acids. Omega-3s promote healthy brains and higher IQ. And watch out for depression. Untreated depression is associated with delayed fetal growth and altered brain development. However, antidepressants can increase miscarriage rates, contribute to smaller fetal heads, and slow growth in the newborn. If depressed, consider transcranial magnetic stimulation, the only FDA-cleared, drug-free treatment for depression with no risk to the fetus. To be smart requires a healthy brain, so be smart, do right, and make your child bright.
To learn more about mental health, visit comeandreason.com.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Well, we're lucky today to have Dr. Steve Wolf with us talking about obstetrics gynecology, and we've answered some questions on birth control, on ovarian cancer. We've talked a little bit about pregnancy. You know, it's risky the older you wait, but you know, many people are going into careers. The next question is a very interesting one too, and I think a lot of people have had this question. It says, I had my first child delivered via a cesarean section, so we'll explain what that is. Would it be possible to have my next child naturally? And we'll explain what that is.
Yes, that's a great question. I answer that question every day in the office, actually. The cesarean section rate in this country now is approaching 30%, or 3 out of every 10 women are delivered by cesarean section, which means the baby does not pass down through the pelvis, but an incision is made on the lower abdomen and the baby is taken out of the uterus and delivered in that manner. It is possible to have a vaginal delivery after you've had a cesarean section, but there are a couple things that have to be adhered to. Number one, the incision on the uterus has to be what we call a low cervical or a low transverse incision, which means it goes across the uterus and not up and down. There are reasons why we have to do the incision up and down, but as long as the incision is low and transverse, then it should be safe for that person to labor again. The risk with a previous cesarean section is that the incision in the uterus might pull apart during labor. And the risk for that in an up and down incision on the uterus, not on the skin, but on the uterus on the inside, is about 5%. So we recommend to those women they not go through labor or attempt a vaginal delivery. We try not to use anything that would stimulate contractions in those women who've had a previous cesarean section. You've probably heard of Pitocin, which is a drug used to stimulate labor. We try not to use that in anyone who's had a previous C-section. There's some other drugs we try to avoid in that case. Some of it also depends upon why you had the cesarean section first time. If it was because your baby was maybe in a breech presentation, usually the second time around, it's very viable to think about a vaginal delivery. Sometimes if it's because the pelvis was too small or there was an obstruction, you may want to think harder about whether or not that person should attempt a vaginal delivery, because it puts a lot of strain on the uterus to contract against a pelvis that's not going to open up for you.
So the transverse incision, it would be okay to do that.
Transverse incision is very important. And if we hadn't taken care of that patient with the previous pregnancy, we go to great lengths to make sure we know what that incision was if we're going to try a vaginal delivery the next time around.
Well, that's very interesting. So, is 3 out of 10, is that a high number compared with the rest of the world, or?
No, actually there are some countries where it's much higher. In South America, it's well up over 50%.
Wow.
In some countries. But if you look back in the 50s, it was very low, the cesarean section rate, but we know more about monitoring babies during labor and things now, and we know the risk of babies being stressed out in labor and things, and quite honestly, there's a lot of public support for more cesarean sections.
250 years ago, when we didn't have cesarean section, I guess the infant mortality, the babies dying during birth was higher too.
Well, just to brag about modern obstetrics, the most common cause of death in women in the reproductive age range before 1930, when we had modern anesthesia, was childbirth.
Wow.
And of course, I'm not sure about infants, but I'm sure that was very high as well. And if you had an obstructed labor where the baby wasn't passing through, you really had no choice but to allow the baby to die in that case, and then to try to save the mother's life. So modern obstetrics and anesthesia have really changed the outcome of pregnancy.
Yeah, I know my wife votes for epidurals every time. Epidurals every time. I don't know, does anyone ever not have an epidural anymore?
Yes. We still have patients that go natural and things, and it's just personal preference. I think epidurals are very low risk, and it's a great form of anesthesia to allow women to enjoy their delivery and things, but we have many women who go natural and want to experience that whole process of laboring.
Okie dokie. Well, you'll have to make that decision, women, if you're out there. If you have questions, we still have a chance to give you a call in today. It's 855-644-3278, or you can go to our website. That's heartwiseministry.org. After the break, we're going to start talking about a question that's come in regarding hormonal replacements. Everyone's interested in the risk and benefits of hormonal replacements. Don't go away. We're going to be right back.
The Heart of Health Live will return in just a moment.
place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance. When to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have ultimate healing?
Nice. No. Oops. Yeah, sure. Let's go.
Moms everywhere are finding ways to keep kids active and healthy.
Works every time.
Get ideas, get involved, get going at letsmove.gov.
Have you ever heard things about God that didn't make sense? Have you ever thought that science and Scripture cannot be reconciled? Have you heard ideas about God that scare you? Or are you just tired and confused? If you want answers to complex problems, if you want a testable, evidence-based understanding of God and the world around you, an understanding in which the Bible and science harmonize to reveal the reality that God is love all the time, then Come and Reason Ministries is for you. Hi, I'm Dr. Tim Jennings, board-certified psychiatrist, and Come and Reason Ministries is dedicated to helping you learn to discern, to stimulate you to think, to help hone and refine your ability to know the right from the wrong, the healthy from the unhealthy, and teach you how to experience healing of your mind, body, and relationships here and now. If you would like an evidence-based approach to knowing God, then visit us online at comeandreason.com.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back to Heart of Health Live. I'm Dr. James Marcum with Dr. Steve Wolf, and I'll tell you, who wants to watch the news right now? It's news time all across the nation, but you can watch Heart of Health Live. Get your questions answered on My Family. We're glad you've joined us today. We're talking with Dr. Steve Wolf. Our phone number here is 855-644-3278. We're glad you're joining us here. Let's start talking about hormone replacements. We get this question a lot, and we're going to start with this. When do you recommend taking hormone replacements? I'm having some menopausal symptoms, but concerned about some of the risks.
Right. Well, you know, this is probably the most hotly debated topic in obstetrics and gynecology. In about 1999, a very good landmark study came out called the Women's Health Initiative that kind of guides us in how we use hormone replacement therapy. That was a study with about 17,000 women that were on hormone replacement therapy. And the conclusion of that was that women who take hormone replacement therapy actually have a gradual increased risk of heart disease, stroke, and breast cancer. Some of the drawbacks to that study are that the average age in that study was age 63. And there was just a specific type of estrogen that was used in that study, and as you know, there are multiple forms of estrogen on the market and multiple forms of progesterones on the market as well. So, and we've had a lot of other studies that were not as good as the Women's Health Initiative that showed that hormone replacement therapy had some good benefits to it. So there's a little bit of a mixed bag right now, but I'll tell you the bottom line is that it appears that women who are on hormone replacement therapy for longer than about 8 to 9 years have a gradual increase in their risk of breast cancer. So we try to, if we're going to use hormone replacement therapy, we try to get women off by about the time they're in their late 50s, you know, 58, 59, 60. Also, we have the thought that the heart disease and stroke actually occurs more in those women, as you know, as a heart doctor, in those women who are older because we all develop plaques in our blood vessels as we get older. Now, the problem with hormone replacement therapy, or the theory, is that the estrogen makes your blood clot a little bit faster.
Right.
So if you have a plaque in the blood vessel where you've got some turbulence in the blood vessel, you may form a clot there and then cause a blockage in the artery. But there's some really good, less well done studies that show that women who are in their 50s can take hormone replacement therapy and not have those issues.
Okay.
There's nothing better on the market for hot flashes, night sweats, mood swings, vaginal dryness than estrogen.
Okay.
So we counsel every patient at menopause, if they're having a terrible time with symptoms, that we could use hormone replacement therapy, and the guideline is you use it the smallest amount for the shortest period of time to get through the symptoms. And then we always try to wean people off in their late 50s and not continue it.
Now, will you use it on someone that's had either a heart attack or a blood clot in their body before?
No.
Okay, so those you won't.
There are people that you eliminate, and,
Right.
and that's why I say it's important that you get with your doctor, that he talk to you about the risks, the pros and cons. As I mentioned, there's nothing that's better for those symptoms. There are just two indications for hormone replacement therapy left. One is symptoms, and that includes all those things, hot flashes, night sweats, vaginal dryness, and the other one is bone health.
Okay.
Estrogen does really help with the strength of bones so that it reduces your risk of osteoporosis down the road. And there are some women who are at such huge risk of osteoporosis that's a really good thing for them to be on it.
It's managing risk again.
Right, managing risk. And but in general, most women who are getting into their 60s probably should not be on hormone replacement therapy for those risks.
Now, everyone wants to know natural routes. Is there any natural routes that take hormones that doesn't increase your risk of clotting and bleeding? Clotting?
There are some over-the-counter methods. There's something called black cohosh, which is an herb that seems to cut down on hot flashes some. To be honest with you, there's not really anything that works with hot flashes as well as that. There are some other drugs, such as some of the antidepressant drugs, control hot flashes, not as well as hormone therapy.
What do you think about exercising as a treatment?
Exercising is fabulous. To control symptoms in particular, hot flashes, night sweats, difficulty sleeping, exercise is a fabulous way. Also, reducing fats in the diet seem to help. A good healthy diet with lots of fruits and vegetables seems to help as well. The good news is that those menopausal changes that most women go through go away eventually.
Okay.
Eventually.
I guess it varies in each woman. Okay.
Right.
Well, we hope you're not out there having postmenopausal symptoms, but if you are, get some help. We're going to be right back after this short break, so stay with us. I'm on Heart of Health Live.
The Heart of Health Live will return in just a moment.
I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
So here's a question. If you love Jesus, and I mean truly love him, people will notice, right? I mean, if Jesus is at the center of everything you do, people will have to notice. And that is exactly what Life Talk is all about. You see, at Life Talk, our goal has always been to connect people to the true source of power, Jesus Christ. We know with Jesus at the center of our lives, nothing is impossible.
There's a place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance, when to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have ultimate healing?
In the small town of Elmira, New York, a boy was born into an all-American family. The odds of him achieving his dream in the fashion industry? 1 in 23 million. The odds of having a child diagnosed with autism? 1 in 88. I am Tommy Hilfiger, and my family is affected by autism. Learn more at autismspeaks.org/signs.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back. We're here talking with Dr. Steve Wolf, board-certified obstetrics gynecologist. He practices in the greater Cleveland, Chattanooga area. We're glad he's been with us. A couple quick questions for her. We got a little bit of time left. How often and at what age do you recommend seeing a gynecologist?
Should first see a gynecologist at the age of 21,
okay,
or at the age of first sexual intercourse,
okay,
which can be quite a bit earlier than that, obviously.
Okay.
Then we recommend seeing a gynecologist on a regular basis, on a yearly basis. And there's a lot of confusion right now because new pap smear guidelines are coming out and things, and actually decreasing the frequency of pap smears. But keep in mind, the pap smear is simply a test screening for abnormalities of the cervix. There's so many other things that we do in exam, checking blood pressure, checking urinalysis, checking general health status, looking for menstrual abnormalities, breast abnormalities. So there's a lot to a gynecologist.
So you have a lot of responsibility because often you're the only doctor that's seeing a woman.
Absolutely. You know, there was a survey not very long ago that showed that 60% of women see no one else but a gynecologist.
Wow.
So we take that to heart, and we try to cover the whole gamut of what should be done, you know, from a preventive health standpoint.
Well, in 5 or 10 seconds, look at that camera, Dr. Wolf. What would you like to share with the world?
Get your annual gynecologic exams and mammograms.
Well, that's great. That's great. Well, we want to thank you for joining us today on Heart of Health Live. Go to our website, heartwiseministries.org, and leave your question. You can be one of our Facebook friends. And we want to encourage you to join us each week on Heart of Health Live, where we will answer your questions. What I do is I collect all the questions that come in, then I get a specialist to answer your questions. We don't send you a bill, we just give you great answers with a specialist on each field. So we want to thank you very much for joining us. Stay with us each week. I'm Dr. James Marcum, thanking Dr. Steve Wolf for being with us this weekend. Join us next time on Heart of Health Live.